There's this idea that we're going to be rationing care. So I'm curious for those of us here to raise your hand if you have been uninsured in your life. Keep your hand raised, and also raise your hand if you've been insured, but your deductible was exceedingly expensive. So almost you rarely went to the doctor or got care that you needed. Thank you. I've been there too. I was uninsured less than a year ago. I was uninsured 7 months ago. And so I want folks to raise your hand again, because I know what being uninsured is like. It's not just a financial issue. It is the stress and it is the anxiety when you wake up every morning and you don't know if you're going to slip on a curb, if you're going to find something on your body that you want to get checked out, if your knee starts to ache. Everything becomes a spiral of anxiety because you don't know how you're going to afford it. So when we talk about rationing care in a for-profit healthcare system with no guardrails, where it's the Wild West, where you're allowed to profiteer off of insulin, off of people's lives, how many of you, in your time of being uninsured or having health care that was too expensive, delayed getting a prescription or delayed going to the doctor? So you rationed your own care. Is that correct, Ms. Burton?
Yes, absolutely.
The cost of a for-profit insurance company forced you to ration your own care, correct?
Absolutely.
I know exactly what that's like. I rationed my own health care for 10 years. I was on a self-imposed wait list for 10 years, not going to an orthopedist when my knee hurt, not going to seek mental health care or counseling when my father died, all of those things. You know, what you shared with us, what you had the courage to share with us, Ms. Burton, about your miscarriage, about the fact that you were forced to that you had a miscarriage in the middle of an emergency room, and you said you were uninsured in that time, right?
That's correct.
You were uninsured, so you miscarried in an emergency room, and you never were able to get the follow-up care that you needed. You never knew what happened to your baby, correct?
That's correct.
Because insurance was too expensive, correct?
That's correct.
Because CEOs needed to offer a profit margin, correct?
Correct.
This right here is a complete condemnation of the for-profit healthcare insurance industry. Because while they're talking about how socialized medicine, how a public guarantee to the right to healthcare will force us to ration care, we are rationing our own care. We're not talking about months-long waiting lists under the system we have now. We're talking about years-long waiting lists for the system that we have now. A key part of the ACA, Mr. Asasi, is Medicaid expansion, correct?
Yes.
This allows people of lower incomes. Medicaid expansion allows people of lower incomes to essentially get covered by Medicaid, correct?
The very most vulnerable people in this country.
And that is a core part of the Affordable Care
Yes.
Act. Now, there are some states that have not opted in to this expansion.
That's right.
I've looked in, some of these states include the states that have chosen to not cover, to not expand care to our lower income Americans that are most vulnerable include Alabama. Is that correct, Mr. Asasi?
That's correct.
Florida?
That's correct.
Kansas?
That's correct.
Mississippi?
That's correct.
Missouri?
Correct.
North Carolina?
Correct.
South Carolina?
Correct.
Oklahoma?
Correct.
South Dakota?
Correct.
Tennessee?
Correct.
Texas?
Correct.
Wisconsin?
Correct.
Wyoming?
Correct.
These are the states that have chosen not to cover the most vulnerable Americans, correct?
That's right.
And these are the states that are also, we're seeing a lot of their representation trying to combat the ACA when they're not even buying into it to protect their own, correct?
We're talking about 2.5 million people who don't have coverage because they have not expanded Medicaid.
Why do you think they are doing that?
Well, I used to work with the governors on this very question, and the truth to that answer is because it was tainted as Obamacare, and it was a completely political decision.
So people are not getting insurance in these states for political reasons. That's your assessment?
Absolutely.
As part of their perpetual fear-mongering campaign against giving Americans health care, Republicans have used every tactic in the book, from claiming that death panels are going to determine whether we live or die, to saying that there will be waiting lists years long and that we'll all just die anyway while waiting. Not sure if you're detecting a theme, but in every GOP scenario, everyone ends up dying. Now, first off, we don't have to pretend that this is all theoretical. Nearly every industrialized country in the world offers some version of socialized medicine, and miraculously, they aren't just barren wastelands of death and despair. Just look at Australia, or Austria, or Belgium, Canada, Chile, Czech Republic, Denmark, Finland, France, Germany, Greece, Hungary, Iceland, Israel, Italy, Japan, Netherlands, New Zealand, Norway, Poland, Portugal, South Korea, Spain, Sweden, Switzerland, Turkey, or the UK. But how could socialized medicine ever work? But now, Republicans have settled on this idea of rationing care, that we'll have to limit what healthcare we can have. Only we're doing that right now. Like AOC described, we self-ration. If someone can't afford the care they need just because it's available, just because it exists, doesn't mean people can afford it. It doesn't mean it's any closer to being a reality for these people than if it didn't exist at all. Thanks to the ACA, or Obamacare, 20 million more Americans got health insurance, but the number of uninsured in this country still stands at more than 27 million people. And the number one reason people cite is that they can't afford it. So to pretend that under a more socialized system we'd have to ration our care and all just wither away in the process is completely ignoring the fact that healthcare in this country is already rationed for a nauseatingly high number of people. Beyond that, insurance companies even ration care, although it's referred to as covert rationing when they do it. They use copays, deductibles, and caps, knowing that if there are limits to what they'll pay for your coverage, it will limit you from getting all the care you might need. Health insurers ration care by limiting the doctors you can visit, even though doctors in your network might not be the best situated to care for you. Health insurers ration care by denying services or reimbursement for services. All of this already exists under our current system, in which we're all at the mercy of for-profit insurance companies. So if Republicans are so scared of rationing, then I've got some bad news for them. There is absolutely no reason, beyond the greed of those who profit from this system, that the richest country on the face of the earth can't afford to keep its citizens healthy. Staying alive in America should not be determined by the extent to which insurance companies stand to benefit from it. That's not giving healthcare, it's taking hostages. And clearly the GOP knows this, but they are so beholden to those at the top, those who are currently the principal beneficiaries of this system, that they don't want to rock the boat. Even if rocking it means ensuring that more than 20 million Americans without health care would have access to it, nearly 10% of our country. In the right's desperation to divert your attention, they'll even point to immigrants as being to blame, claiming that our system would be fine if we didn't have to pay for them. And they fully expect you to believe that if a sick, undocumented immigrant is looking for some basic care in a hospital, that the cost of giving him medicine is what's crippling our system, as opposed to the insurance companies raking in billions. If you truly believe that giving a brown kid some Tylenol is the root of our problems, when health insurance CEOs are raking in hundreds of millions of dollars a year, then your logic might just be a tad skewed to the right. The fact is that Republicans would rather forego health coverage for their own constituents, would rather let them die because of lack of health care than allow something with Obama's name on it to succeed. Because that's all this comes down to: petty partisan politics. So the next time that Republicans say they'd kill for a win, they mean it literally.